Perceptions of Health by Grace Sufert.
And Tole Farah.
Introduction. Our topic poses the question of whether students with a meal plan perceive their eating behaviors as healthier than students who do not have a meal plan. Although self-perceived health is a subjective assessment, doing research in this area helps evaluate the general health of a given population. Our study is relevant to us because it allows for an understanding of health-related behaviors to people in our social circle. Furthermore, we learned that individual perceptions of health can influence one's decision to engage in certain behaviors. For example, if individuals perceive their health as good, they will likely maintain their current lifestyle. However, it is essential to note that perceived health is only sometimes congruent with an individual's actual health status.
Review of literature, eating behaviors among children. We found a lack of academic research that considers college students in this area of study. However, we did find literature on eating behaviors in K-12 school environments. The Food Research and Action Center found that school lunch is critical to student health and well-being, especially for low-income students, and ensures that students have the nutrition they need to go throughout the day to learn. This article helped us understand that socioeconomic aspects factor into the health and well-being of students. Furthermore, in support of our original hypothesis, the CDC states, research shows that students who participate in the school meal programs consume more whole grains, milk, fruits, and vegetables during meal times and have better overall diet quality than non-participants. Lastly, childhood obesity states, compared to children with a school lunch, children with a lunch brought from home were significantly less likely to have fruits, vegetables, and dairy. Although these studies were focused on K-12 students, they support our argument that eating meals on campus leads to healthier behaviors and overall diet.
College students and consumption of fast food. Another piece of literature found in the Journal of American College Health studied the association of meal plans and health consciousness in college students with the number of meals they obtained from fast food restaurants. In conclusion, the study found that increasing levels of health consciousness and reducing stress to fast food restaurants through flex plans may reduce college students' consumption of fast food. This source also backed our hypothesis that students who obtained a meal plan card perceived their eating behaviors as healthier.
Gender and perceived health. A study in the Journal of Environmental and Public Health assessed the intake of fruits and vegetables in a sample of Kuwait University students to determine its relationship with gender, body weight, and family monthly income to explore perceived barriers to eating fruit and vegetables. They found significant gender differences, with males consuming more fruits and vegetables servings per day than females. This study was the most significant because it included factors of gender and income to apply to perceived health, and it studied university students.
Lastly, the effect of money on eating habits. The Journal of American College Health states food insecurity in college students is associated with poor eating habits. So much of the research we have found associates less affluent students with increased health when consuming campus meals. However, in more affluent areas, as our research found, students perceive their health as better when eating off the school's campus. In our survey, we didn't include socioeconomic status as a variable, but we realized that it may play a factor in the results.
Methodology. We intend to explore the under-researched topic of perceived health and meal plans. We collected a mix of both qualitative and quantitative data, or mixed methods, by sending out an LMU Qualtrics survey that we created based on a survey design introduced in class. We utilized the non-random convenience sampling method by sending out our survey link to LMU peers and friends beginning on March 10th, 2023. The survey was taken online over the course of a month. Our questions were low risk. We did not ask students to provide data on socioeconomic status, body weight, or mental health. Our independent variable is the meal plan, and the dependent variable is perceived health.
To design the survey, we used an existing scale of 22 different questions from BMC Public Health Journal, the Healthy Lifestyle and Personal Control Questionnaire. The Healthy Lifestyle and Personal Control Questionnaire was made to measure the lifestyle pattern of individuals who have increased control over their health, indicating their degree of empowerment, which is the main goal of contemporary health promotion programs. The study did not apply a qualitative conclusion. They merely promoted the HLPCQ as a tool for researchers to administer the study, degrees of empowerment, and healthy lifestyle habits.
Our chosen research method measures what it was intended to measure, and therefore it has validity. Moreover, our measurement method is reliable because our responses were relatively consistent over time. We operationalized perceived health through our survey questions. The survey had a yes or no question regarding having a meal plan. We used a Likert scale 1 through 4 and multiple choice questions to measure our variables, perceived health, and meal plan status. We also had 4 open-ended questions to get qualitative data. Our inclusion-exclusion criteria were simply based on if our participants were students at LMU or not. If not, they were redirected and unable to complete the remaining questions.
We used Excel to analyze our data and create a one-tailed t-test using our means from 2 columns, those with a meal plan and those without a meal plan. The t-test equation that we used is t-test array 1 array 2 tails type.
We acquired 39 responses, 9 of which we could not use due to them being incomplete. Therefore, our final sample size was 30, and our response rate was 76%. We utilized our inferential test, which was a t-test, to accept the null. Our reason for using a t-test was because we wanted to compare the means of our 2 variables, which were meal plan status and perceived health, one of which is binary categorical and the other continuous. We rejected our hypothesis stating that students with a meal plan perceive their eating behaviors as healthier than students who do not have a meal plan. This was because our found p-value was 0.086, which is significantly above the communication studies alpha level of 0.05. We found no significant difference between college meal plans and perceived health. Our mean for having a meal plan was 50.9 and no meal plan was 55.2. From our data, we could not conclude that students with a meal plan perceive their eating behaviors as healthier than students who do not have a meal plan, as surrounding research suggested.
Discussion. We were limited by a small sample size since we could only get 30 complete survey responses. If we had a larger sample size, we could have potentially been able to accept our hypothesis because our 2 means were different, again, one being 50.9 and the other being 55.2. Moreover, we had no reverse coded questions included in our survey, so we had no way of knowing if our participants were just clicking through the answers options or actually taking the time to respond truthfully. We also only conducted research in the LMU community, so we did not obtain the full scope of university students.
More interestingly, existing research found a connection between income and perceived health. Previous research associates less affluent students with increased health when consuming campus meals. However, in more affluent areas, students perceive their health as better when eating off the school's campus. Therefore, our findings may have been influenced by the fact that the LMU community is considerably affluent compared to other nearby areas. Further research and future research in this area should be conducted with the inclusion of economic status as a variable.
There is a lack of research regarding perceived health and meals on and off college campuses. More readily available research would aid students in becoming aware of how their meal choices could affect their well-being and overall health.
Thank you so much for listening.